We know from the work in the Patient and Client Council, it does make a big difference if people get involved. Sometimes you can wonder how the differences are going to be, how they're going to materialise. Actually, we know from the work that we have done with patients with cancer, patients attending accident and emergency services, that by talking to us, by telling us about their experiences, we can use that information to make a difference to the service. And that is really important for people who are accessing the services today, but increasingly for people who are going to be using the services for tomorrow and beyond.
My own personal journey, I just want to share this interview to give people hope. You know, if you're confident and you feel you can move on and help others, feel free to do it, because I think it's the best thing ever anyone could do.
There are tremendous benefits in getting service users and carers involved in inputting to how our services can be improved. In fact, it's the only way that service improvement can happen within the health service and within particularly our own mental health services.
The only person that knows is the person with a learning disability. I want to speak up to make others understand what it is like to have a learning disability.
It's important for people to know that they can get involved.
For anyone wanting to get involved, I would say go ahead. It may not seem to be an easy option for you because you have been through a rough time, but there are a lot of benefits to be gained from it.
Patient experts can be partners together with the health professionals, so that the experience of both patients, carers and health professionals can be enhanced and can be the best it can be, because what the patient stroke carer brings to the table is an experience of the condition, living with it, coping with it, and then the health professionals, they know all the technical stuff. And when you bring those two together, you can integrate them so that the best possible outcome can be for all concerned, and that experience has got to be enhanced as a result.
Well, it's incredibly important for people to be involved in services and how we deliver services, because they can make a tremendous difference to the quality and delivery of care. I have a personal mantra that the people who can tell us most about how we can improve our care in the future are the people who actually receive it. They're the experts. They know what will improve care, so therefore it's incredibly important that they're engaged in care delivery in the future.
Because together, service users, carers and professionals, we can have a better outcome all working together than we can have in isolation.
Most people, I think, appreciate that when they deal with professionals, they're dealing with competent people who know their particular skill or expertise. What I think we're very interested in is, what did that feel like to you? What was the experience like for you? Was it a good experience? Was it not a good experience? And the only way we can actually really learn is by talking to people. So I would certainly encourage everyone to take every opportunity they can to let us know. Sometimes we might have to hear uncomfortable messages. That's fine.
It's difficult at first, but don't give up. Hang on in there. Keep fighting. Keep having an input. And remember that what you're doing will benefit you, it will benefit others who are service users, it will benefit carers, because what we're hoping to do is to have as good a service as we possibly can.
Well, if you want to make a difference in how we provide care, if you want to be a part of the new innovation and the new creation of care for us in health and social care, then you want to be involved in actually helping us plan.